So pleased to be able to chat with Mike Shanahan of Maria Drost Counseling Services in Quincy Center about how this current pandemic crisis is affecting folks here in Quincy emotionally. Mike, so really appreciate the opportunity to talk to you. Thanks for joining us.
Thank you, Joe. It's good to be here with you.
For folks who may not know, I always like to kind of start with a little history lesson of Maria Drost and what your mission and your goal and your history is.
Thanks, Joe. Yes, Maria Drost is in its 28th year, and we've been in Quincy Center for that whole 28 years, located right next to Craig's Cafe. We're up on the second floor and originally started by the Sisters of the Good Shepherd and run now by a completely lay staff with one active sister still on staff, providing low-cost and even no-cost mental health services to the Quincy area and beyond.
And assuming, like everyone else in this current age, that your current offices are closed, is that right?
That's right. We're observing the state advisory to stay out of the buildings, and we're doing therapy now from our homes, and all the therapists, there's 25 of us, they're all doing therapy from their home using telehealth platforms and even the telephone. So by whatever means necessary. So our doors are still open, metaphorically speaking, even though that we're not physically in the office.
Right. So, I mean, let me ask you, have you seen, a change in your clients' needs during this current crisis?
Yeah, it's been interesting because the first, couple of weeks of the coronavirus, we had some cancellations and even no-shows. I think people were in shock and maybe forgetting their appointments or kind of wondering what to do. And now there's a slight uptick in, our normal clients that we've already established relationships with are coming in and resuming their appointments, and the phone is starting to ring again. So I think it's changing as this evolves. But yes, the focus in sessions has been more on the kind of day-to-day impact and everybody's particular context, because it varies. There's people that are living alone and they're kind of isolated. Then there's people cooped up in the house with small children, and that's a completely different situation than, say, what I have. I have 2 adult children, so the 4 of us happen to be here, and so it really varies client to client, situation to situation. So our therapists are tuning into what the particular context is of each family and each client that we have.
Yeah, it really is kind of hard to have any kind of discussion with anyone, really, without this kind of overshadowing, that whole context. So, I mean, folks who maybe have been vulnerable already, are you seeing that their needs, for help are increasing now?
Yeah, a little bit, because it's hard to get out. And if you need medical supplies or you're worried about your health, people are afraid to go to the hospital. So there's kind of a fear of, well, what if I get sick with something else, and then I have to go to the hospital. And that's where we're hearing on the news that, some of our healthcare providers themselves are coming down with the coronavirus. So there's a real fear of just getting sick for other reasons that aren't even the coronavirus.
Sure. So what are you kind of, advising for coping techniques for folks to get through this, and still have some sound mental health?
Yeah, it's a good question. And, in general, what we do is we pay attention to their particular context and try to address their immediate needs. But in general, we're telling people, if you're cooped up in the house, to try to get out, to vary your routine every couple of hours. So, some people might be binge watching TV or something, but we're saying, do that for a couple hours, get up, take a break, hydrate yourself, try to get outside if you can. We're able to go outside and take walks and take a walk on the block or ride your bike. So there's evidence that people are taking advantage of that. But also to eat healthy, keep yourself hydrated, and just try to be a positive presence in your situation for the other people that are in your house, especially children who, they're questioning what's going on. We're all trying to adjust. And so we're trying to support adults and parents to be their best so that they can pass on more positive energy to their kids and keep their household calm and safe.
Yeah, what are some kind of, red flags, Mike, or warning signs that folks should be aware of, both, in themselves and in their family members, where the situation might be having a negative impact?
Yeah, it's just really to monitor your own stress level. Like all of us adults, you know when you're kind of getting more stressed and when you're cooped up with people in the house, if you're snapping at the kids or, more intense conversations with your partner. It's just the advice is to take a step back, maybe to take a walk, change your routine and just kind of break the pattern and say, I need to, what can I do myself to just calm myself down, because I see that the fear of this is kind of getting the best of me and now I'm reacting and broadcasting that out. So it's really about kind of self-centering and doing mindfulness techniques that we talk about to help keep people centered. So it's really no different than what we would do anyway. It might just be we're doing more of that, or it's more intense right now if you're kind of stuck and dealing with particular family situations, as well as the fear of getting sick, or even dealing with somebody who might have it in your home.
Right. And you said something important, I think, is to put your feelings out there, express them, vocalize them. It helps you get through them, and it helps other people understand why you might be acting that way.
That's right. I always teach my clients to go with your second response. Sometimes the first response is maybe the angry one or the one where you're reacting. And then if you can catch yourself, you can say, oh, I'm sorry that, it didn't come out well, or I'm a little tense because of the situation. So let me rephrase that, or let me say it in this way. And then, all of us, I think, can accept an apology and can make an adjustment. It's like, yeah, no, that's okay. I understand. Right. So we do teach that, and clients are able to put that in practice. It's a way to kind of catch yourself as you're learning to be a better version of yourself.
Yeah. Have you seen, an influx of new clients since the pandemic broke?
Well, it's been a little down. I think people that are looking for new clients that are looking for mental health are looking up telemental health therapists. And, Maria Drost, typically we've done therapy in person. And so we haven't necessarily come up as telemental health. And so we've adjusted our profile on Psychology Today and put that up on the website just to have people be aware that, hey, now we're doing telemental health. So there's been a little bit of a dearth of new clients in the past couple of weeks. But like I said, it's starting to pick up. I think there was the initial shock of the first 2 or 3 weeks, people not knowing what's going on and even maybe staying away. And then now, I think as it goes on, I'm kind of predicting we're all going to get busier. As week 2 and 3 and 4 turned into week 5 and 6 and 7. Right. We're all probably figuring that we're going to be in our homes and isolated like this through April, and the kids aren't going back to school now till the early May, and and then there's some thought, well, maybe that's going to be extended even for the whole year. So right. We really don't know how long it'll be like this, but from a mental health perspective, the longer it goes on, I think people are going to resume, hey, I need to talk to somebody, and then all of the mental health centers will be getting more calls. So I feel in general that it's going to just start going up after this original period of kind of, what is this? And, who am I in this whole thing?
Right. Does that worry you? Does that concern you at Maria Drost? Will you need more counselors, more help to get through that?
Well, we're kind of limited by our space and by, we have, there's 25 of us who are, so it's a robust staff, and I think we're doing fine in terms of answering the need that's out there right now. But yeah, it could increase. It's hard to say. We can only do what we can do, and fortunately with mental health, there's a lot of providers in the area, and now that a lot of us are doing the telemental health, it does open up other possibilities, and perhaps therapists who maybe saw even part-time 10 clients a week now might be able to see 15 or 16, so I think there's a certain amount we can do, but it will be in coordination with all the other mental health centers, kind of everybody doing what they can do. I hope it's that we can all provide services to people that need it.
Right. I'm curious, at Maria Drost, do you think this, virtual form of counseling might continue after the pandemic subsides?
Yeah, I think so. I was just saying that to the staff. We've never really done telemental health in the past because there was no need for it. And we've certainly been busy enough with the people coming to our office. But now that we're all doing it, you kind of learn how to do it and learn its maybe benefits as well as, how to do it. And most of us who just did in-person mental health thought, well, it's better if you can have the person actually in the room. And in many ways that is true. And yet, now that we're doing it over the phone, we're finding, well, you still are able to listen and tune in to a person. It might take, a little longer, but it's not like it can't be done. So I think we're all adjusting our views on what's possible. And I think Maria Drost and other places will probably continue some form of telemental health now that we're all doing it. So I think that's very true.
Yeah, I'm finding that with a lot of folks that I've talked to, in traditional face-to-face organizations are finding that, there are other options that might be, something to fall back on in the future too, when quote unquote normal resumes.
Yeah.
For someone, Mike, who's maybe finding themselves in crisis right now, kind of a mental health crisis right now, what would be your advice to them?
Well, it would, if you have a relationship with a counselor, it would certainly be to call them and let them know. And if it's an immediate crisis, we always tell people to call 911 or to go to the, your local emergency room or even call the police. That's always your best option. So that still remains the best option. You can't mess around. If there's something serious going on to you or somebody in your house, you have to reach out and call someone for immediate help. And so we can certainly provide assistance over the phone for our clients that are in crisis. But even with our own clients, we would tell them, if it rises to a certain level where there's safety issues involved and so forth, or suicidal ideation or a plan, to absolutely call 911 and get the proper people there to help you out immediately.
Sure. At Maria Drost, I know we should let folks know you are a nonprofit organization. Who is eligible to utilize your services?
Well, we do take anybody. We're a nonprofit by virtue of the fact that we offer our sliding fee scale. So if people can't afford mental health or they don't have insurance, and even those with high deductibles and copays, we've always been able to reduce the fee to make it affordable to them. So we do take everybody that comes through the door, as long as they're qualified for outpatient mental health as opposed to inpatient or something. But
right.
If you have health insurance, we see people with health insurance and everything in between, down to clients that, in some cases we've waived the fee 100%. Wow. To help them out, just so that they're getting the service they need. So that continues. There's no change in that. That is our mission, and we'll always have that as our mission and focus.
Right. Are you finding that folks are leaning on their faith a little bit more than they may have in the past, and do you counsel that for them?
Yeah, we always are open to the whole person's view of what is in their context. And for a lot of our clients, different faith traditions are in their context. Mm-hmm. And so when they're bringing up matters of faith, we do roll with that. And a time like this does cause you to kind of question what's God doing, or what does this mean? And what does it say about society? And so as always, faith is a wider perspective that opens us up to bigger thoughts that, it's like a mountaintop view that you can get some insight into life or why things are happening. And then you come down from the mountain into the marketplace where you deal with life stressors. And so this doesn't change anything. We would still employ compassion-based living. Maria Drost is a compassion-based place, so we try to operate out of this compassionate response, which allows us to use this sliding fee scale. Mm-hmm. And so we do teach compassion-based response as a stance of living to people, and that is a spiritual principle that fits in really with all religious traditions. And so it's really a teaching that says to go out and be your best self, and that doesn't change even in a crisis or a pandemic like this. So we're telling people, do what you can to be healthy. And right now that's, wash your hands, take Purell with you, all the precautions are being taught and that are on the news, but also to do things you need to do maybe out of your religious tradition that helps keep you to be a more loving, more balanced person. And I think when you look at notions of spirituality or what holiness means, it's always about being balanced in your response, so that your presence is always a safe presence to others, to your family and to the community, and that you're reaching out in proper ways. So none of that changes now. In fact, I think it becomes more important that we actually live that way and put those principles into practice.
Yeah, I've always found that helping others also helps yourself, and I think that is true in this situation too, for sure.
That's true.
Are you able to help folks with English language barriers at all at Maria Drost, Mike? Is that something that you can help with different languages?
Well, unfortunately, all of our therapists are just English-speaking therapists.
Okay.
So I've been trying to get somebody in to Maria Drost that's bilingual. It's just harder to come by. So there are translation services you can apply for that. If a client speaks a different language, you can have a translator come into the office. And so we have that on occasion. But there are, it is probably one of the weaknesses we have as a small mental health agency, that we don't have more therapists that speak other languages. That would be a big bonus. And so if anyone out there is interested in that, come and see me. I'd love to talk to you.
Yeah. Okay, great. And how about for children? Do you have special counselors that focus solely on child psychiatry?
Yes, we do have child therapists, and right now that's been the toughest thing with this, because we haven't found a real successful way, especially for the smaller children, to do teletherapy children, because normally what you do with kids is you're doing play therapy, where you're actually on the ground playing games with them or drawing things. And so it's not impossible, but it's just a lot more difficult to do over the phone. And so some of our clients that are children, the parents have called and said, well, we'll probably just wait this out till we can bring, our son or daughter back in physically. And we completely understand that. So that is probably the biggest casualty, if you will, of the current situation. But we're still able, we'll talk to anybody. So if there's any children we're seeing that want to be on the phone or on the phone with their parents, we're certainly open to that.
Sure. I know that you did have a fundraiser coming up later on in April, obviously, that has been, is it canceled or postponed at this point?
Well, we moved it to September. So now it's the third Thursday in September. I think it's September 17th of 2020. And so we're hoping at that point, of course, that, everything's done and we're back gathering in large groups. But again, we don't know. We'll just have to see what develops over the summer and how people are feeling. So we're hoping it can happen. And if not, we'll make modifications. So that's just something we and every other company is having to deal with. We're all being impacted financially and in every other way. So we're part of a large community of nonprofits as well as for-profit companies looking at their bottom line and seeing it suffer to varying degrees.
Right, and to that point, I wanted to make it clear that donations at Maria Drost are accepted and welcome, and obviously put to good use.
Yes, obviously, and all the time. So there is a donate button on our website, which is just mariadrostcounseling.com. One L in counseling, and Drost is D-R-O-S-T-E. There's an E at the end of it. So Maria Drost, by the way, was a sister of the Good Shepherd who died in 1899 at the tender age of 37, and was known for her robust heart of giving to people and living a compassionate life, and people just flocked to her for advice and help. So we're proud to take our name from her. So that's where Maria Drost came into play.
Okay, and she would have lived through a pandemic probably in her lifetime, so would be familiar with what's going on today.
That's right.
Yeah. And a good phone number, Mike, for folks to get a hold of you?
Sure. Call 617-471-5686. And we're so that the phone, or we're answering our phones, we're checking the phones every day, as well as the website is another way you can apply to.
Okay, and hours of operation, have those changed at all, or are those still the same?
No, in fact, I would say the hours of operation now have expanded as people are, we can make a call from our homes anytime. And right. So, we always tell our clients to arrange that with your therapist. And so I think therapists are, people that could only come in the evening, for example, now are at home, and they're telling us, well, I can talk to you at 10 in the morning. It doesn't matter. So yeah, so our hours of operation are really probably more flexible now than ever.
Okay. Anything else do you think we should touch on? I just, my whole goal was kind of just to let folks know that there is help available out there if they're finding themselves feeling stressed out where they might normally, or just also to let your clients know that you're still there for them too.
That's right. We're still open. You can check out our website and just give us a call, and we'll call you usually within a week and set something up for you. So you can be on the phone with one of our counselors within 1 to 2 weeks. Absolutely.
Okay. Are insurers, have you made any changes at all to their coverage for mental health services that you're aware of?
No, I mean, insurers they're helpful in terms of recognizing the pandemic, and so they've assured us that they're paying for telemental health services, and
great.
So yeah, so everything's being cooperative from a payment point of view, and again, we work with our clients. So if payment is an issue or somebody lost their job and they need a discount, we're right there. We kind of work with their ability to pay and ask them what they can afford.
Mm-hmm. Great. Appreciate your time, Mike. Really, I know that you've been straight out on these video calls and phone calls, so to take some time out to share information with us here at QATV, I really appreciate it.
Thanks, Joe. It's always good to be with you, and I appreciate you reaching out.
Oh, our pleasure. And hopefully we can do it in person again real soon.
I hope so too. That'd be great.
All right. Be well.
Thank you, Joe.